Hi everyone on Dental Tools. I'm Dr. Olivier Kerkuak, and it's exciting for me being able to offer you this time of continuous education experience here on Dental Tools. Today I'm going to speak about how we, dentists and dental hygienists, can work as a team to preserve healthy peri-implant tissues. Dental implants are an integral part of most dental practices. Also, clinicians who are less involved in the active role in implant therapy meet patients who already carry dental implants. As the number of patients treated with dental implants continues to grow, the dentist and a member of the dental team are confronted with challenges of maintaining healthy peri-implant tissues around sometimes complex implant-supported restorations. Implant therapy can be seen as a chain where successful outcomes depend on a number of links and factors. While surgical technique and biocompatibility of implant components determine healing following implant placement, the long-term success of implant therapy requires preservation of the obtained integration between the implant and the host tissues. An evidence-based, team-oriented approach to supportive therapy is essential to ensure the longevity of dental implants. Let me introduce to you Gunilla and Yuan. Some of you already know this dental team. Gunilla is a well-educated general practitioner who performs dental implant treatment both surgically and prosthetically. Yuan is a dental hygienist who has worked with Gunilla for many years. Both are very nice and clever persons, and they would like to know how to help their patients and preserve healthy peri-implant tissues. They are also curious and have several questions we will try to answer. Why is it important to examine peri-implant tissue, and what is the best way to examine them? Why should we follow up our implant patient? How should we perform our maintenance control? And how often should we meet our patients for supportive therapy? Which are risk indicators for peri-implantitis, and how can we treat peri-implant diseases? So, why is it important to examine peri-implant tissues? The examination of peri-implant tissues is fundamental in the maintenance and follow-up of implant-treated patients and can be performed by both dentists and dental hygienists. Inflammatory lesions that develop in the peri-implant tissues are collectively termed peri-implant diseases. In accordance with the classification of periodontal disease around PIS, peri-implant diseases includes two entities: peri-implant mucositis, which corresponds to gingivitis, and peri-implantitis, which corresponds to periodontitis. This peri-implant mucositis is a condition that describes inflammation in the mucosa, while peri-implantitis, in addition, also affects the supporting bone. For the appraisal of peri-implantitis, the detection of margin bone loss in radiograph is also needed. In this context, it's important to distinguish between the bone remodeling that occurs early after implant installation and the loss of supporting bone that may be detected around implants during function. Thus, for appropriate evaluation of bone level changes around implants, a reference radiograph obtained directly after the delivery of the prosthesis is required. How should we examine peri-implant tissues? The method to be applied in the clinical examination of the tissues surrounding implants resemble those used in the examination of the perineal tissues surrounding teeth. Thus, probing represents one of the critical assessments and includes not only the appraisal of the probing pocket depth, but also the more important detection of bleeding on probing. Provided that normal force is applied, that the peri-implant tissues are accessible, probing peri-implant and periodontal tissues is regarded as a predictable and reliable procedure in order to distinguish between healthy and diseased tissue, as you can see